This is Dr. Michael Ryan with Missouri Vein Care answering a question, which is, could chronic fatigue syndrome actually be a vein condition in disguise? And the answer for most people is no, but for some it is possible that that's what's going on. Chronic fatigue syndrome is a debilitating condition that has arisen in the last 35 years out of the blue. No one knows where it came from, why it exists. So it's a medical mystery at this time. And it may be related to changes in our environment, our diet. We just don't know yet. But the fundamental diagnosis revolves around this overwhelming fatigue and exhaustion malaise. And one of the characteristics of the chronic fatigue syndrome is that it occurs only when you're exerting yourself. And so it can occur in the morning, the afternoon, the evening, throughout the day. When you begin to exert yourself, it becomes overwhelming. And the result of that is that people don't move very much. They have a psychological impact, which is very negative, and they get depressed very frequently. Another byproduct of what appears to be a condition that has a high level of inflammation in the body is brain fog. Brain fog is a condition where there's fuzzy mental functioning, nothing really specific. You can't really pinpoint that this is what's going wrong, but you just aren't sharp. You're not up to your normal self. In addition, likely related to the inflammation circulating in your body, there is unrefreshed sleep. In other words, people can go to sleep and sleep through the night, but they wake up and they just feel washed out. Now, what's interesting is that some of those symptoms are the symptoms that can be present with a vein condition. There are differences, and the crossover is that both a vein condition and chronic fatigue syndrome appear to have an inflammatory basis for all their symptoms. It's a little bit more is known about what causes the symptoms in a vein condition than chronic fatigue syndrome. And in a vein condition, the symptom pattern is very reproducible and very predictable, and it's related to the development of inflammation in your body because the vein circulation in your legs is not working and the blood is sitting there pooling. It's not moving. It's stagnant, and that triggers an inflammation reaction that causes a lot of symptoms in the legs. And the symptoms build up as the day goes on, as the presence of the stagnant blood is kind of cumulative throughout the day, and that could be while you're sitting or standing. And then the symptoms really peak in the evening, even after you are no longer moving around and you're resting. The symptoms are peaking because the inflammation is now stirred up in your body, and that causes a fatigue. And the fatigue pattern with a vein condition is different than the fatigue pattern with chronic fatigue syndrome because it's really predominantly in the evening or late afternoon. At some point during the day, it hits people and they really hit the wall, and that is the inflammation building up in the body. And the inflammation is like a poison to your cells and preventing your body from generating energy and utilizing it, so your body just kind of runs on empty. Part of that also, this inflammation that's built up in your body will accumulate, and it peaks in the evening just when you're going to sleep. And that inflammation is known to have a direct negative effect on the sleep center of the brain. So people with a vein condition, at least 75%, report very poor quality sleep that improves after treatment, and that is the basis for it, is the inflammation from the vein, stagnant vein circulation has been reversed and eliminated so that now your sleep health can improve. In addition, obviously, when your circulation improves, your energy level, activity level improves, and leg symptoms improve as well. So for some people, but not all, there may be actually a vein problem causing some of the symptoms that are now known as chronic fatigue syndrome. The best way to get it sorted out is with a vein ultrasound. A vein ultrasound looks at the veins under the skin, and those veins we can see if they're not functioning properly, and we can look for that stagnant blood flow. That is the telltale sign that there is a vein circulation problem. And if that's present, then vein treatments will significantly improve the situation in terms of fatigue, sleep quality, and your leg symptoms as well. So the first step is a vein ultrasound. The next step is to try compression stockings. This is what I recommend people. If there is some improvement in your symptoms, and that's a good clue that whatever symptom is that has improved is related to your veins, and further vein treatments will help even more. So that's something people can try on their own. You have to make sure you have a decent strength in the stockings, and you can see more information on our website about how to sort that out. And then if you get a vein treatment, then you certainly will get improvement if you've seen some improvement with the compression stockings. So Dr. Mike Ryan answering the question, could my symptoms of chronic fatigue syndrome actually be due in part to a vein condition?